Well, thank you for having us with you. I'm Donna Lalwani. I'm the clinic's outreach professional, and I have one of our physicians, Dr. Sood, with us from Amen Clinics, New York.
How's it going? This is the first time I've ever been in a theater, so this is pretty awesome, but a little bit nerve-wracking, so hope you guys enjoy what I'm about to say.
Well, Amen Clinics, I think we're very aligned in the area of brain health, so we appreciate you involving us in this opportunity. But we're really a global leader when it comes to research and working in diagnosis and treatment for a variety of brain health needs and optimization for clients that come in on the wellness spectrum, as well for other individuals that have experienced challenges with their brain health and want to seek the support in getting more accurate diagnosis and then developing a more comprehensive and individualized treatment plan with one of our physicians. And so, as you know, Dr. Daniel Amen is our founder and CEO of Amen Clinics, and he set up 6 clinics nationally. New York is rather the newest clinic, but we have one in DC, Atlanta, and I know we've been rolling out in terms of partnerships and collaboration with Miriam as an educational partner in this process, and with Bellevue, San Francisco, and Orange County, where we have each of our clinics. But Dr. Daniel Amen has been a double board certified neuropsychiatrist and has been very excited to share at the NERIAM International Conference the importance of improving brain health and how we can do that in terms of rehabilitation. Dr. Daniel Amen was a medical consultant for the film that you're about to see, Concussion. And so it brings to light an important topic that's very near and dear to us, and I'm sure so very many of you and those that you serve and know in your families, your loved ones, and the community that you touch every day. And so it's rather interesting with Dr. Amen's research that he's been involved in looking at players from over 27 teams in various and all positions. So we wanted to talk with you a little bit about brain health and bring to light some important pieces that relate to concussions and aspects for recovery and rehabilitation. And so I wanted to give Dr. Sood a little bit of time to also speak with you more specifically about his approach and the work that he does in working with youth through adults across the ages. He's board certified in child and adolescent psychiatry, board certified in adult psychiatry, and also a board certified pediatrician.
Yeah, so yeah, I can get started. Hopefully this will be better than the movie itself. I doubt it. But so I'll kind of talk to you guys briefly about why I got interested in this work. So I trained at an academic facility in New York. We're based in Manhattan. And, one of the things that I would see recurrently over and over again is these kids would come in with, after a fall or after getting tackled, come to the clinic a few months later or to our pediatric outpatient services and report, not feeling well, fatigued, feeling depressed, maybe a bit anxious. And, the conventional approach was to recommend cognitive behavioral therapy or, start someone on a SSRI, an antidepressant. And, while we were kind of treating the symptoms clinically, I wouldn't really see significant improvement. I've worked there for 5 years, so I could follow these children longitudinally. So I became interested in the impact of trauma on the developing brain. What tends to happen when a child or an adult has a traumatic injury is and the parents are concerned or the family's concerned is you go to the emergency room. If there's loss of consciousness, you get a CT or an MRI, usually a CT scan, and inevitably what happens is they're normal, right? And so now you've exposed this individual to radiation and really haven't figured out much. You've prevented maybe something really severe from happening by diagnosing or excluding a diagnosis, but you really haven't intervened in a manner which I felt was just felt right. So one day I'm sort of sitting on my couch, watching some sports, football, which I kind of don't watch too much anymore, but I was watching football, and then I turned the station to PBS, and I saw Dr. Amen speaking about SPECT imaging. So, it was a form of imaging that I'd heard of, but I wasn't very familiar with, and it seemed pretty cool. He was talking about how SPECT looks at the functionality of the brain, in contrast to MRI or CT, which looks at structure. And the thought is that by looking at the function of the brain, we can more accurately ascertain what's happening to the brain right after injury, what the effects of the trauma have on the brain, and this can lead to more accurate diagnosis and quicker intervention. So I explored further, and I luckily was able to land a job here and been working here for almost 2 years. And what I do on a daily basis pretty much is evaluate people through the use of SPECT imaging, pretty thorough history, and some cognitive testing. And I see, or whether the impact of that injury has had, what the impact of the injury has been on the brain. And it's been phenomenal, and I feel like transformative in my practice. I've been able to more correctly diagnose and intervene. SPECT shows us what parts of the brain are overactive, what parts are underactive. It also can help people when they're really worried and there's no reason to really worry. So you can help reassure folks. It gives us a more holistic way of looking rather than just guessing. And so that's sort of the nature of the work we do here. After we do the evaluation, work with the person on 4 levels, right? Biological, psychological, social, and a spiritual level. So it's a very holistic approach, and I think that sort of fits in with what you guys are doing. So it seems like this is a great collaboration. I try to, first do no harm, right? We can do a lot of harm as a medical community, myself definitely included. The medications we use can do wonders, as you may know from personal experiences, but they can also do harm, and harm that we're really still not really confident in terms, we're not sure of how much harm it does. So supplements are one of my major interventions. Motivational interviewing, figuring out where people are in terms of their desire to seek treatment. See a lot of adolescents who struggle with depression and anxiety as a result of head injury. So maybe not using supplements, a ton of supplements is the way to go. So it's really just meeting people where they are. So supplements, medication, therapy, hyperbaric oxygen therapy. I don't want to get into the details. I'm going to be giving a talk next week. So I figured, just sort of introduce you guys to maybe, or if you've heard of us, look further, but introduce you to kind of what we do here. I am available by email. I love being in touch with people. That's the way I learn. I sometimes learn more from, I feel like I learn more from my patients than my patients learn from me sometimes. That's the way I approach this, sort of an exchange. So please email me if you have a pen and you're taking notes. My email is D as in, so it's Doc, D-O-C, S as in Sam, O-O-D, as in David, at amenclinics.com. Welcome any questions, and hopefully this is informative, and enjoy the movie.
Thank you. Again, if you wish to place a call as well, our number at the New York Clinic is 646-736-5893. Thank you.
Thanks.
Do the same. Enjoy the film.